There's a topic most men rarely feel comfortable talking about. Does frequent ejaculation actually harm the prostate? Some believe that doing it too often can weaken the body, cause inflammation, or even lead to prostate cancer. On the other hand, scientific research has also suggested that regular release may actually help protect and improve men's health. So what's the truth behind this? In today's video, we'll dive into some little-known scientific findings to answer this question once and for all. More importantly, we'll uncover the best ways to take care of what experts often call a man's second heart, a small but powerful organ that plays a huge role in male health and vitality. If you find this topic valuable, don't forget to hit that like button to support the channel and stay tuned for more useful content on men's health and confidence. Chapter 1, the prostate, the hidden key to men's health. When people talk about men's health, they usually think about the heart, liver, kidneys, or overall sexual performance. But very few realize that there's a small gland deep inside the body that directly affects fertility performance and even a man's confidence, the prostate. Many experts even call it the second heart of men. But what exactly is the prostate and why is it so important? The prostate is a walnut-sized gland weighing about 20 grams, located right beneath the bladder and wrapped around the upper part of the urethra. This special gateway position links the prostate to both the urinary and reproductive systems. That's why any changes, whether enlargement, inflammation, or tumors, can impact not only urination, but also fertility. The essential roles of the prostate. The prostate takes on three major responsibilities: producing prostatic fluid, a clear liquid that makes up about 20–30% of semen. This fluid nourishes sperm, shields them from the acidic environment of the vagina, and boosts their mobility for a better chance of reaching the egg. Coordinating ejaculation. Acting like a controller, the prostate helps regulate and complete the ejaculation process smoothly. When a man reaches orgasm, the prostate contracts powerfully, pushing prostatic fluid and sperm out of the body. If the gland doesn't function properly, ejaculation may feel incomplete or disrupted. The prostate also works like a natural biological valve, preventing urine from flowing backward during ejaculation. The prostate and its silent troubles. Although many men have heard about prostate-related conditions, few truly understand what they mean. The most common is prostatitis, which often causes painful urination, frequent urges to pee, pelvic discomfort, and sometimes even pain during ejaculation. Another widespread issue is benign prostatic hyperplasia, BPH, which typically appears after the age of 40. It leads to difficulty urinating, a weak urine stream, and the need to wake up multiple times at night. Even more concerning is prostate cancer, one of the most common cancers in men, especially after age 50. These conditions clearly show how much the prostate impacts not only physical health, but also sexual quality of life. Why is the prostate called the second heart? This nickname is far from an exaggeration. The prostate directly influences a man's performance, confidence, and sexual satisfaction. It also serves as a mirror of aging and reproductive health. When the prostate starts showing problems, it's often a signal that the body is entering the aging phase. Just as the heart pumps blood to sustain life, the prostate nurtures and protects sperm, the essential factor for preserving fertility and passing on life. Chapter 2, the science behind ejaculation. To answer whether frequent ejaculation harms the prostate, we first need to understand how the process actually works. Ejaculation is not a simple reflex. It's a complex sequence involving the nervous system, hormones, and multiple reproductive organs, with the prostate playing a central role. It all begins with sexual arousal. When a man becomes stimulated, nerve signals travel from the brain down the spinal cord, triggering muscle contractions in the reproductive organs. At the same time, levels of testosterone rise, heightening arousal and fueling the production of sperm and prostatic fluid, all in preparation for that final explosive release. When arousal reaches its peak, sperm leaves the testicles, travels through the vas deferens, and reaches the seminal vesicles before entering the prostate. At this point, the prostate begins to release its signature fluid, rich in enzymes, zinc, and citrate. This fluid blends with the sperm and seminal vesicle secretions to form semen. The vehicle that keeps sperm alive boosts their speed and provides the perfect environment for fertilization. Without the prostate, sperm would struggle to carry out their reproductive mission. At the moment of orgasm, the muscles surrounding the prostate and urethra contract in perfect rhythm, pushing semen out with powerful force. On average, each ejaculation releases about 3 to 5 milliliters of semen, and this is when the prostate works at its maximum capacity like a biological pump running at full speed. But ejaculation does more than just expel semen. It also cleanses the prostate, flushing out old fluid and bacteria that could otherwise linger and cause infections. What's fascinating is that this entire process is controlled by the sympathetic nervous system, which acts like a switch, triggering the coordinated contractions of the prostate, seminal vesicles, and pelvic muscles. After ejaculation, the hormone prolactin rises, creating a sense of relaxation and guiding the body into recovery mode. This mechanism shows us that the prostate serves both as a fluid factory and a biological pump. Regular ejaculation keeps the gland running smoothly, just like starting an engine often prevents it from rusting. However, overdoing it can lead to excessive strain, which may cause inflammation or functional decline. That's why scientists have always been intrigued by the connection between ejaculation frequency and prostate health. In the next chapter, we'll explore the proven scientific benefits of regular ejaculation and why it can be a vital key to both prostate health and overall male well-being. For decades, frequent ejaculation has been surrounded by negative myths. Many believe that releasing too often could weaken the body or even lead to erectile dysfunction. But modern science has proven the opposite when done at a healthy level. Ejaculation actually brings surprising benefits for the prostate and men's overall well-being, preventing prostatic fluid buildup. The prostate constantly produces fluid in preparation for reproduction. If this fluid isn't released regularly, it can stagnate, creating an environment where bacteria thrive and infections develop. Every ejaculation triggers strong contractions in the prostate, flushing out old secretions and keeping the gland clean. This natural self-cleaning mechanism helps maintain a healthier environment and lowers the risk of infections. Lowering the risk of chronic prostatitis. Clinical studies show that men who ejaculate at a reasonable frequency are far less likely to suffer from chronic prostatitis compared to those who rarely or never do. The contractions during ejaculation improve blood circulation and help remove lingering bacteria inside the gland, reducing the chance of long-term inflammation, reducing the risk of prostate cancer. That's why doctors often recommend maintaining a regular sex life, not only for reproductive health, but also as a preventive measure against prostate cancer. A well-known study published in the Journal of the American Medical Association, JAMA, in 2016 revealed that men who ejaculated about 21 times per month had a 31% lower risk of developing prostate cancer compared to those who only ejaculated 4 to 7 times monthly. The main explanation is simple. Frequent release of prostatic fluid helps flush out potential carcinogens before they can cause cellular mutations that may lead to tumors. Relieving stress and improving sleep. Ejaculation isn't just about reproduction. It also impacts the nervous system and mental health. After orgasm, the body releases hormones such as endorphins, oxytocin, and prolactin, which naturally reduce stress, promote relaxation, and make falling asleep easier. Men who maintain a balanced sex life tend to experience less stress, better sleep quality, and improved mental health, all of which indirectly enhance reproductive health and overall vitality. From another perspective, regular ejaculation also helps keep sperm fresh. When semen is stored too long in the body, sperm quality can decline, making them more vulnerable to day damage and reducing their ability to fertilize an egg. Frequent ejaculation works like a natural refresh cycle, clearing out aging sperm and allowing new, healthier, and more active sperm to take their place, boosting fertility potential. This is why fertility experts often advise couples trying to conceive to maintain regular intimacy instead of avoiding sex for long periods. From a scientific standpoint, regular ejaculation provides remarkable benefits for both the prostate and overall health. But as with anything in life, too much can backfire. When the body is pushed beyond its limits, the positives can quickly turn into negatives. Chapter 4. Too much ejaculation. The hidden downsides. While moderate ejaculation can be highly beneficial, overindulgence may lead to multiple health problems. This aspect is often overlooked as people tend to focus only on the benefits without recognizing the risks of going overboard. 1. Physical fatigue and energy drain. Every ejaculation consumes energy and releases a surge of neurotransmitters. If it happens too frequently, the body doesn't have enough time to recover, resulting in fatigue, weakness, and reduced focus. Some men even report back pain, sore knees, and feeling sluggish or drained the next morning. 2. Increased risk of prostatitis. The prostate is essentially the pump that contracts to expel semen. When it's forced to work too often, the gland can become overstimulated, which over time may cause inflammation. Prostatitis, triggered by excessive sexual activity or frequent masturbation, often comes with painful urination, frequent bathroom visits, pelvic discomfort, and even pain during ejaculation. Left untreated, this condition can turn chronic and seriously affect quality of life. 3. Nervous system and hormonal imbalance. Ejaculation is not just a physical reflex, it's closely tied to the central nervous system and the endocrine system. Overdoing it can disrupt the balance of hormones and neurotransmitters, leading to a range of negative physical and psychological effects. When ejaculation happens too frequently, the sympathetic and parasympathetic nervous systems are forced to stay active without proper rest. This constant strain can eventually lead to nervous system imbalance. At the same time, testosterone, the cornerstone of male vitality, begins to fluctuate abnormally. Such hormonal imbalance may reduce sexual desire, cause erectile dysfunction, and gradually weaken sexual performance, while also taking a toll on mental health and intimate relationships. Sexual addiction, a hidden danger. Excessive masturbation or overly frequent sexual activity can lead some men into sexual addiction. This issue extends far beyond physical health. It affects mental well-being as well, causing guilt, anxiety, and loss of self-control. More importantly, it often harms real-life relationships as the body becomes conditioned to intense stimulation, making it harder to enjoy satisfaction in normal intimacy. Sexual dysfunction. Overstimulation of the nervous system can also make the pathways that control erection and ejaculation overly sensitive. As a result, men may experience erectile dysfunction, premature ejaculation, or difficulty sustaining intercourse. Research has consistently shown that frequent masturbation increases the risk of these conditions. A broad impact on men's health. Clearly, excessive ejaculation affects not just the prostate, but the entire male body, from physical strength and hormone balance to the nervous system, mental state, and overall sexual well-being. That's why maintaining a healthy frequency is the key to enjoying the benefits of sexual activity while safeguarding long-term health. Chapter 5, how much is enough? And one of the most common questions men ask is, how many times per week should I ejaculate to stay healthy and protect my prostate? While it sounds simple, there's no universal answer. The right frequency depends on multiple factors: age, physical condition, overall health, and lifestyle habits unique to each man. Although there's no universal number that works for everyone, modern medicine has provided useful guidelines based on scientific research. Each body has its own limits and recovery ability. Some men in their 20s can have sex or masturbate almost daily without feeling drained, while others at the same age may feel exhausted if they go beyond 2 to 3 times a week. The key is that a safe frequency should depend on your body's recovery capacity, not on a fixed number. Suggested frequency by ages 18 to 30. This is the peak of male vitality with high testosterone and abundant energy. A frequency of 2 to 4 times per week is considered healthy and balanced. Ages 30-50. Health and stamina begin to decline slightly, so the body needs more recovery time. Around 1 to 3 times per week is a reasonable range. After 50, the prostate and reproductive systems start to age, making the body more prone to fatigue. A frequency of 2-4 times per month is recommended to maintain function without overloading the system. Of course, these are just reference numbers. The most important thing is to listen to your body and adjust according to your actual condition. Warning signs of overdoing it. When you push too far, your body sends clear signals: pelvic or groin pain, persistent fatigue, painful urination, reduced sexual desire, difficulty reaching orgasm or trouble maintaining an erection. If you notice these symptoms, it's time to slow down and allow your body to rest. Medical advice. Urologists confirm that ejaculation is not harmful if kept at a moderate level and combined with a healthy lifestyle. A man who eats well, exercises regularly, manages stress, and sleeps enough can safely maintain a higher frequency than someone who is sedentary stressed or living with chronic conditions. Ejaculation should be viewed as a natural bodily function. There's no need for excessive restriction, but overindulgence should also be avoided. Quality matters more than quantity. What truly counts is the experience itself, especially when shared with a partner in a fulfilling relationship. A balanced sex life not only strengthens physical health, but also nurtures emotional well-being, giving men confidence and lasting happiness. In reality, excessive masturbation often provides only temporary relief, leading to dependence and reducing the quality of real-life intimacy. That's why men should always aim for balance, viewing healthy sexuality as a natural part of life rather than a habit that drains energy. The question, how many times is enough, doesn't have one definitive answer. It varies with age, health status, and lifestyle. The real key lies in self-control, understanding your body, and maintaining healthy habits. This is how men can truly protect their prostate and preserve their masculinity for the long run. Chapter 6. Keeping the prostate healthy for life. Though small in size, the prostate plays a critical role in male reproductive health, vitality, and quality of life. While regular ejaculation offers many benefits, long-term protection of the gland requires a comprehensive care strategy, proper nutrition, balanced lifestyle, regular exercise, mental well-being, and medical checkups. Anti-inflammatory diet. Food directly impacts prostate health. Research shows that a diet rich in leafy greens, fruits, omega-3 fatty fish, and nuts reduces the risk of inflammation and prostate enlargement. Among these, tomatoes, which contain the powerful antioxidant lycopene, are considered one of the prostate's best allies. On the other hand, excessive consumption of red meat, fast food, alcohol, and caffeine can irritate the prostate and worsen urinary symptoms while also increasing inflammation risk. Physical activity and Kegel exercises. Regular physical activity boosts blood circulation, lowers stress, and helps balance hormones. Men are encouraged to engage in moderate cardio exercises, such as jogging, swimming, or cycling, to improve pelvic circulation. Additionally, Kegel exercises often associated with women can be just as beneficial for men. Strengthening the pelvic floor muscles improves urinary control, enhances ejaculation quality, and supports the treatment of erectile dysfunction. Maintaining healthy sexual habits. Sex is an essential part of overall male health. A regular, safe, and balanced sex life keeps the prostate functioning properly and supports long-term vitality. On the other hand, over-reliance on excessive masturbation or uncontrolled sexual behavior can overload the gland, leading to inflammation and dysfunction. Above all, quality matters more than quantity. Stress management and sleep. Chronic stress is a silent enemy. It disrupts hormones, lowers testosterone, and indirectly harms prostate health. That's why experts encourage men to adopt stress management practices such as meditation, yoga, deep breathing, or simply enjoying personal hobbies. Equally important is sleep. Getting 7 to 8 hours per night gives the body time to repair, strengthens the immune system, and protects the prostate from harmful factors. Regular checkups, the lifelong shield. Another crucial step is regular medical screening. Men over 40 should undergo PSA prostate-specific antigen testing and an annual prostate ultrasound to detect enlargement or cancer early. Proactive prevention and early diagnosis significantly improve treatment outcomes and long-term health. Conclusion. Does frequent ejaculation harm the prostate? After reviewing all the scientific evidence, the answer is clear. Ejaculation is not harmful to the prostate. In fact, when maintained at a reasonable frequency, it is a natural biological process with numerous benefits, flushing out stagnant fluid, lowering the risk of infection, and even reducing the chance of prostate cancer. It also improves mood, supports better sleep, and maintains sperm quality. However, too much of anything can be harmful. Excessive ejaculation, especially from compulsive masturbation, can lead to fatigue, prostatitis, erectile dysfunction, and reduced sexual satisfaction. That's why balance is the golden rule. Each age group and each individual body has its own optimal frequency, and men should learn to listen to their bodies to find what works best. Ejaculation can be seen as a natural medicine for the prostate, but like any medicine, it only works when used correctly. Instead of worrying or over-restricting, focus on building a healthy lifestyle, a balanced diet, regular exercise, effective stress management, and routine checkups. With this approach, your prostate will stay strong and support you throughout life. And if you found this knowledge useful, don't forget to hit like and subscribe to Gentleman's Vitality, where we share practical, science-based insights on men's health, sexual wellness, and lasting confidence.